Welcome to the Personnel Committee of the Albany County Legislature.
Stop breathing.
Chairman Mark Grimm, to my left is Vice Chair Lynn Lakakis, and I'd like to call attendance as well. Sean Ward, Rick Touche,
Here.
Ray Joyce,
Here.
Allison McLean Lane, Lucille McKnight,
Here.
Joe O'Brien,
Here.
Travis Stevens. Okay, we have a quorum, so we'll continue. First order of business is approving the minutes. Do I have a motion? Mr. Joyce?
Second.
Touche? All in favor?
Aye.
Unanimous? Okay, if it's okay with the members, I'd like, because we have some folks waiting, I'd like to skip ahead to the health insurance and dental insurance agenda items, which we'll be moving to 8. Any objections to that? Okay. All right, again, go ahead. Just for every guest, please, your name and title.
Steve Losi from Losi and Gale. We're the consultant works with the county.
Okay.
I'm Commissioner of Human Resources.
Sean Dillon, Commissioner of Management and Budget, just a minute.
Okay. Any introductory remarks, Jen?
The first resolution is for Empire Blue Cross Blue Shield to administer the Albany County Health Plan for employees and retirees under 65.
Okay. How, just overall on costs, to give us some sense of what it's, how we're doing in terms of cost management, and because I know the benefits that we talked earlier, the benefits are remaining the same. We're keeping all those intact for our employees. But how are you managing the cost of this program?
Albany County pays claims, and we have a TPA that administers the, processes claims and administers the health plan on our behalf. So we have contained costs, being in a self-funded plan. And I'm not sure if you're looking for, there is an attachment with the claims over the course of 16 and 17.
Yeah, can I just ask about that? This is,
Sure.
Did everyone get the email, by the way? There are a number of questions the council raised, and then the questions were answered on the email. Did everyone get that?
Yes.
Okay, and then the questions were quite thorough, and so was the responses. Yeah, would you like to speak to that?
So just for the members' knowledge, there were a number of questions that our office sent out to the commissioner regarding, well, we're on item number 8, but the questions regarding items 8, 9, 10, and 11. There was an extensive list of questions. We got a very comprehensive response back from the commissioner. And from my perspective, the questions that I have were answered, like I said, comprehensively. So,
Okay, I'd just like to ask you, under Empire BCPS, the administration costs were 2.39 million in 2016 and 1.97 million in 2017, so they actually went down, which is surprising to me. Do you understand, is there a reason why the administration costs went down from year to year?
They're based on claims costs and claims processing. So although the claims cost may go up, it may be due to a large claim. So the processing of the claims costs could go down from the administrative
Because the
perspective.
paid claims did go up from 25.5 to 30.5 million, but is that largely due because the type of claims, some medical claims cost a lot more than others?
Yeah, there's been a huge increase in the catastrophic claims that we've been seeing over the last 4 or 5 years, not only, in this area, but throughout the state. The number of $1 million cases is way up, so we are seeing a bit more catastrophic claims, and obviously that's exacerbating the paid claims trend a little bit. I will say from Empire Blue Cross Blue Shield's perspective in terms of the health insurance plan, for the years that they've been involved, the increases have been less than 7% on average over the years that we've been here, which is better than the national trends. In terms of the administrative fee, it is a per contract per month fee that is charged, so depending on the number of contracts that are insured, things of that nature, and with the Medicare age folks being carved out, we did see a bit of a decrease in the administrative fees over the years because of obviously some decreasing in staffing, and then also the Medicare age folks being carved out. So some of that fluctuation is a result of that as well.
Okay, so you said there's more catastrophic claims. Give me a couple of examples, if you would.
Well, in terms of some of the things we're seeing, I mean, on a daily basis, in terms of the groups that we're consulting, we see not only, the cancer cases and the transplants that are substantial, in terms of those folks just having claims over $50,000, which doesn't sound like a huge amount from our perspective, sounds like a huge amount from your perspective probably. Those are up substantially. We're seeing, 10, 15, 20% increases in that level. A lot of that has to do with some of the specialty pharmaceuticals that are out there, but a good chunk of that also has to do with things like joint transplants. It seems like everybody today is getting a knee or a hip or a shoulder done. Those by themselves are $30,000, $40,000, $50,000 alone, let alone the physical therapy and the rehab afterwards, the drug therapies that go with it. So that's a lot of where we're seeing that increased cost. And quite frankly, the members are shielded from that. With the Albany County program, it's a very robust program. The out-of-pocket, the cost sharing from the members' perspective is pretty low and pretty capped, so the brunt of it gets, put on the county a bit in terms of the plan payment, unfortunately.
Mr. Touche.
So am I reading this correctly? In 2017, we had 45 more claims than we did in 2016, but we paid out $25 million more? Am I missing something?
Where are you reading that from, Rick?
From the...
Oh, that's the chart below that is for the dental. That's
that's the
dental related.
Okay.
So that's not affiliated with dental.
Are there any other questions from members? Mr. Jordan?
Yep, I do. Jen, thank you. You know why too, right? That being said, what's the plan for the outreach to the, say, seniors? And I know I'm probably jumping ahead. I'm looking specifically at 11, but this applies to number 8 as well. It looks like the physician coverage almost doubles from what MVP provided, both, we'll just say for our retirees. Is there some plan to go forward saying, hey, we're now going from MVP to Empire? And
We would do a rollout to our 65 and over retirees for transition to Empire from MVP. And that would, yes, the network is definitely much more extensive within Empire. And we would do a rollout over a 68-year period.
okay. All right.
And a full education piece as well.
Yeah, I could see that could lead to some confusion as it did when we first rolled out MVP, but thank you again.
Any other questions? Is there a motion to move item 8, which is involving the Albany County Health Plan for employees and retirees under 65?
Motion move.
Mr. Joyce? Mr. O'Brien, second. All those in favor?
Aye.
Opposed? Unanimous? Item 9 is authorizing agreement with Express Scripts to administer the Albany County prescription drug plan for employees and retirees under 65. Let me just ask a little bit. Does Obamacare affect any of the health care plans in the county at all? Even any indirect?
Yeah, the Affordable Care Act, when it
Affordable Care Act.
it came in 2010, certainly changed the landscape quite a bit in terms of health insurance. We had to add quite a few benefits, certainly on the preventive side. All preventive services now for adults and children are 100% paid. Obviously, we did have to bump up the dependent age to 26. There were a number of other mandates that have come through since then, either at a state level or a federal level, whether it's mental health parity or some other things that have come through. But yeah, certainly the benefit plan is better today than it was prior to the Affordable Care Act. And as a result of that, anytime you add benefit, you're going to add some cost. So we have added some costs as well to the program as a result of those.
Okay. Yeah, something, John? No. Okay. This is regarding prescription drug plans. There's been a lot of talk about, trying to find, better pricing on prescription drug plans. And how did we address that in this item?
Well, in terms of the RFP itself, we did go through an extensive evaluation of a number of drugs. We basically gave all the prescription benefit managers a list of medications by what they call NDC code, so that we would get specific pricing on every single drug. And I don't remember how many it was. I think it was around 100 medications that we priced out to try to get a good global perspective on the pricing. I can tell you, in terms of our understanding, our knowledge of the business, Express Scripts not only is one of the largest PBMs in the country, but also is one of the most widely used in terms of insurance carriers using them for their back room. I know in our area, Excel's Blue Cross Blue Shield uses them, as does Empire Blue Cross Blue Shield here locally. A lot of the insurance companies use them as their backroom prescription benefit manager because they do drive the deepest discounts and the best rebates. So from that perspective, I think the county's in really good shape by working with Express Scripts. Obviously, it's good to test the market periodically. There's been a lot of consolidation in that area. We want to make sure that we're still got good pricing, and from this RFP, we're pretty convinced that you do.
Okay, any members, questions?
I want to know how much money we get in the rebate. I think that's in the backup.
That wasn't.
Rebates?
That is something we're going to be providing in terms of the exact dollar amount. What they're doing now, it used to be that the county used to get checks. So there used to be a check that was written back to the county quarterly and easily identifiable that way. Unfortunately, the business has changed quite a bit. Now what they do is they credit them off of the claims. So in order to go back and give you an exact dollar amount, we just have to go back and do a little bit of research. But I can tell you certainly the rebate amounts are significantly higher today than they've ever been, predominantly because of those specialty drugs. We see a lot more use of those specialty drugs. You know, they're $10,000, $15,000, $20,000, $30,000 a month, some of them. So we are seeing a lot of return on rebate. Unfortunately, it's being far outpaced by the increase of some of those drug costs on the other end. But, you know, certainly we'll get you that information as soon as we can.
And I have another question sort of on this. It might be related more to aid than anything. Is there any, do you ever like survey users, or like is there any part of customer satisfaction in when you make these choices across the board? Like what does it say, like, you know, I know Empire recently subcontracted to Allegiant, I think it was, and there was like a big hoopla to go through that. Like, so I was just wondering if you ever talk to employees about how they experience these decisions that we make.
A direct employee survey, I know that Empire themselves does a customer satisfaction survey, but in terms of HR, doing an employee survey in terms of their benefits, the benefit plan is, the parameters are set. Whether or not they're satisfied with the particular vendor that we've selected but the plan parameters are set. We don't, those can't be altered. So in terms of satisfaction with the plan administrator, we rely on Empire, but we have not conducted a direct employee survey.
Just wondering.
Okay, any other questions? Is there a motion on item 9? Mr. O'Brien? Seconded. Mr. Knight? All in favor? Opposed? Unanimous. Item 10, authorizing agreement with Delta Dental to administer the Albany County plan for non-union employees. Any significant changes from your point of view from last year?
They have reduced the administrative cost going into this next contract period from the current administrative fee.
Any questions from members?
Motion move.
So, hang on.
Hold on a second.
So Express Scripts is gonna be our exclusive prescription plan?
Correct.
Yes.
Okay, was there another one formerly?
No.
No, it was Express Scripts.
So,
Wait, this is not, by the way, this is item 9.
let Nick have a question.
I just want to ask, we're still going through Canada RX for some drugs, or has that changed at all?
It is not, we still provide the option for brand only
Yeah,
through
through Canada.
Canada RX.
And it's still zero copay for that?
Zero copay for
Yeah.
Canada RX.
Are we going to see another contract like we have, what we're looking at with Express?
Under a separate,
Not a direct contract with CanRx. The county can't technically contract with CanRx directly because of the laws,
Right,
basically
right.
federal laws.
Yeah.
So basically what happens is it's offered to the members.
Yeah.
The members are basically accessing the program and the county's reimbursing them for those prescriptions, and that will continue. I will tell you that the usage is down a little bit from what it has been historically, predominantly because a lot of the big blockbuster drugs like the Lipitors and some of those have now come off patent and are available generically, so they're cheaper generically in the United States than they would be through Canada. But there's still some good usage going through. I think it's about $170,000, $180,000 a year in medication, so there is some savings associated with that, and that will remain.
Any more questions on the Delta plan? Do I have a motion?
Motion move.
Mr. Joyce, second. Mr. McKnight, all in favor? Opposed? Unanimous? Item 11, authorizing agreement with Empire Blue Cross Blue Shield to administer the Medicare Advantage Plan for Medicare eligible retirees.
We have to have you the sponsor of that one.
Any questions on this item? You got any more questions?
I want to move it.
I have a couple of questions.
Sure. Mr. Singalacci? Yes.
Hi, I'm Ralph. I have a couple of questions. So looking through this and looking at the numbers, I noticed that MVP, who is our current administrator, they were at 363, and then the low bidder, which is Empire Blue Cross, is at 272. So that's a significant difference in premium. And the savings is, I see it, $1.3 million, which, you know, Albany County's looking for all the savings. My questions are this. With the premium being so low, what safeguards do the retirees have that premiums are not going to increase dramatically over the course of the next few years? Because having an increase, and everybody was pretty much kind of consistent, but it seems that Blue Cross was very low in this bid. Which is my first question, and I just want to know what kind of safeguards were going to be put in place for our employees. Second question is that this was something that was bid several times. We'd only seen the last grouping of documents, so I would like to see the original sealed bids that came in on multiple occasions to see how they're best and final and how it was changed. And earlier it was said, you know, with the catastrophic $1 million cases, the 10, 15, 20% increases. So how does that wind up affecting, you know, such a dramatic drop? And this is with dealing with an elderly population as opposed. So how can, you know, we be Empire Blue? It seems like that they're almost buying the business, so to speak. And the last question is, and I've heard it for years and just rumors and innuendos. Does anybody in Losee and Cahill, have they ever broke for any insurance company, or do they hold any business with any health insurance company?
I can address the last one first, I guess, and the answer is no. In terms of the companies that Albany County does business with, we've never had any relationship other than working with them through the county. We don't receive any commissions from any of them.
Even prior to the brokerage firm that you have, nobody's ever worked for Empire Blue?
No.
Okay.
I worked for Blue Cross Blue Shield Syracuse for 4 years when I first got out of college, but that was in 1986 to 1990. I've never had any connection with Empire Blue Cross Blue Shield.
Okay. So on the increase, or the premiums that are dropping, so all retirees, their premiums are gonna decrease, correct, based off of this?
They would. And basically, the premium that's being quoted is for a full year. It's community rated,
Okay.
this program. And one of the factors, and one of the big factors that goes into the premium for these insurance carriers that do the Medicare Advantage is the amount of subsidy that they get from the federal government. So when their rating is improved, their subsidy grows. And as a result of that, they can manipulate their premiums a bit. Can I tell you for 100% assurance that this is not a lowball? No. I mean, it's a community-rated program. They do have to stand by that. But if for a year from now, if the rate does go up, you know, we certainly have the ability to go back out to bid to secure another quote. So you do have that protection. But in terms of this year, this is a guaranteed rate for the full year.
Full year from January to?
December 31.
December 31, but health rates come out in July, correct? Increases come out in July for the following year?
They come out there throughout the year. I mean, a lot of insurance companies for the community rated programs actually issue rates on a quarterly basis For January 1 effective business on a community rated basis, you generally wouldn't see those till the third quarter of the year in terms of renewals.
Is that something that, Jen, that you can provide the legislature with monitoring? Because it just seems that this is way below when you look at dollars and cents. I mean, it's, to me, the savings is great, but, you know, at what cost? You know, and what's going to happen next year? Because if increases go in and everybody's going to be paying considerable more, I mean, we are here to wind up protecting the sick, the frail, the poor in our workforce, especially the elderly population. So it does seem, it's, as you know, I have people on the plan that I'm concerned about. So it's great that they'll wind up seeing a reduction, but also I don't want to see the numbers wind up jumping back up in 12 months, 8 months, 24 months that are going to wind up being substantial and kind of putting people eating dog food and cat food and putting them out of their homes and all that good stuff, so.
Sure, we
that's,
can provide updates on the premiums for the following year.
For the following year, and that, when is the best time to contact you? Because I'll have our councils that are here wind up contacting so that we can make sure that that gets out to all 39 legislators, because I think that's very important. So when would be the best time to contact you about rates, about going increased in rates?
September is for the following year.
September of the following year. So the rates, this is going to lock in, so the rates that come out next month for September wouldn't have any effect. These are the rates that are going to be for a full year, then it'll be the following September, so September of 2019 would be the next time that the rates
For
come out.
the 2020 rates, correct? Yep.
So if they go up substantially, what safeguards does this body have to wind up revisiting this, that this may not be the proper contract or policy for our retirees?
Well, similar to how we're
What was
sitting here
MVP's
now, we
original
would
contract,
rebid
1.6
and
million?
bring another contract before you. Should the
But-
rates
1.6?
substantially jump and we put out a RFP and receive rates better.
What's that?
And this current RFP took
Yeah, 5 point-
approximately, what,
yeah.
12 to 18 months?
We did like you were saying, rebid to refresh the rates being offered.
Okay, is there a way of seeing the rates first time through? That should
Sure.
all be sent with documentation before we possibly vote on this, in my opinion. I'm not on this committee, but I ask those that are on this committee to take that into consideration.
Mr. Joyce, you had a question, then Mr. O'Brien.
Yeah, I'm listening to Ralph, and I'm hearing what he's saying. I'm just thinking if Empire's rates go up, it's safe to say everybody else's rates would go up too, correct? So, that being said, MVP went up from, I think, 1.6 million to almost $6 million, so it's the nature of the business.
I get you, I'm just saying, what happened in the past was in the past. I'm looking going forward. I mean,
Yeah.
You see a considerable drop off from our current provider, a savings of 1.3 million.
Yeah,
So looking into 2019, for those that are still alive and on the plan, having increases, what kind of increases do they have? I mean, it was stated earlier that the average increase is 7%, and that our providers are Empire Blue on the retirees under 65 and current employees are less than 7%.
no,
So-
I'm familiar with the plan, I'm familiar with the MVP plan, and it's something I've been watching for a few years now, and it's something that's kind of close to my heart. And I think this is a win for Albany County, so, but I hear what you're saying. We'll see what it looks like throughout the year.
I would just like to have those before we vote on it, to wind up having, at least my vote on the full body, I'd like to see what those first round of quotes are.
I have the same concern that Ralph has. Is there some sort of cap on the increase that they can charge, or they do double digits, or they have
It's a premium plan, so we don't have control over what they're imposing the rates for the following year. However, we do have the option to go out and re-RFP and get new quotes
on the
for the
state,
Medicare
on the
Advantage.
state level, they have to apply for increases, correct? These insurance companies?
Yes, they do. They have to file with the state. And the state does monitor
Is there some
the
way,
rates on these.
is there some way
Contract
of,
is locked, though, isn't these, aren't these prices locked for a year?
They are locked for a year.
So these contract prices are locked for years.
yeah, I understand that, but Ralph's concern and my concern is it's next September, they go up.
They go up.
18 months, it's a long time to get another,
What's the increase that it can wind up going up? I mean, if it just looks that it's a lowball number.
yeah, you
12
pay,
months from now.
pay me now or pay me later. is it?
Exactly, it's my train of thought with the big,
Mr. Bergdorf?
I must be missing something here, because health insurance kind of moves as a commodity with the industry, and it goes up and down. And I bought gas today for $2.71 a gallon, and a month ago, it was $2.93 a gallon. And I'm not looking to pay $2.93 today because I'm worried about, not saving the money. I can't imagine that we wouldn't go with a $1.6 million savings, and then even if it went up 50%, we'd still be at a 50%, or if we lost half of the savings next year, you'd be in a position where you'd still be, your 3-year average would be, $500,000 a year savings. So if from what I'm understanding, is you have the ability to track these rates, and if you see them up, you have the ability to re-RFP, lock people in, maybe go out for a year and a half term or a 2-year term. Do you have the ability to go beyond 1-year rates?
Medicare Advantage programs, I believe, are limited to 1 year.
1 year. So really, it's going to be...
The 50% rate that you talk about, Mr. Bergdorf, I would be happy to send all of those residents to you, and you can explain that it's only 50%, the county still saves money, but you gotta pay 50% more in your premium.
No, but you'd rather have them continue to pay the higher rate today?
No, this is my concern. I'm good with the 1.3 million savings, but I'm saying that you've had the savings now, is it gonna be, pay less now, pay more later? Where is it, because of the amount of savings is too substantial, and that's kind of, when I looked at it, I was like, wow.
I understand your concern.
We have a motion to move item 11.
I'll make that motion.
Mr. Joyce. Second? Mr. Touche? All in favor?
Aye.
Opposed? Unanimous. Okay, back to item 1. Thank you.
Thank you for your thorough bits of information. A lot of
All right, item 1, local law F for 2018, a local law of the county to amend the Albany County Charter to implement an anti-nepotism policy. Table, okay. Table, have a requested sponsor. Item 2, regarding a pay equity study for all employees of Albany County. Is that tabled at the request of sponsors? Okay. Item 3.
I have a quick thing on that. For the previous pay equity, has anybody found that, and can that be sent out to the entire legislature? They did a pay equity study about 10 years ago or so, I believe. And I know when I was taking this around last year during the budget process, I asked for a copy, but I never received it. We can do this.
All right, you guys will look at that, okay. Item 3, promoting Albany County employment, promoting a diverse workforce, tabled by sponsor. Item 4, adopting a policy regarding the legislative summer internship program. Mr. Ethier?
Yes, thank you, Mr. Chairman. I'm looking to move this out of committee, either with a recommendation or favorably or unfavorably, or just send it out.
If you would just summarize, what would you like to do?
I think it speaks for itself. It's just a plan where every legislative district would be able to have one employee from their district if there's a qualification, and they apply.
One intern.
Intern.
Yeah, we're talking about the summer intern program.
That's what the summer intern program.
73 interns that just completed the program, 47 college, 26 high school. A very successful program, a lot of smart.
It has been for years.
Yeah, it has been for years.
It ain't nothing new, it's always been successful.
Yeah.
But I want to assure even better by make sure every legislator in their district are at least guarantee one position if somebody does
Yeah, I did some research because this was on the item, and I want to thank the chairman's office. They were very good at providing this. But of the 73 interns, there were 11 districts that had no interns at all. And there were 32 interns from the city of Albany. There were some districts, in one case, that had 6 interns, and there were a number that had 5. So there was quite a discrepancy among the districts about who had interns and who didn't.
Did you get any information about the application process?
No, I just have how many 73.
Because it's an application process, I think it makes it difficult to mandate that one come from each district, because they have to elect to participate, they have to fill out a lengthy application, they have to want to work at the county, they have to match up, it's like 10 steps before they actually get the job. So I think it would be really,
Cumbersome.
yeah, cumbersome, but not even fair to the people who might happen to live in the same district and happen to want to really be in, CFS or something, whatever. They want to work with kids, they want to do this, they want to learn how to do
Has the
lawyer.
old system had any problems? I mean, we've had, how long is this internship going on? How many years? All of a sudden, there's an issue? Bill?
I didn't say there was an issue. I didn't say there was anything wrong with the program. I just want to be sure every legislative district can have an employee from their district if they put an application. So no problem, nothing. And I don't see what's so hard if we get 600 applications, and you read the address, well, that person is from District 13. That's all. And we say hire them, but at least they be considered. And we have one from every district. There's 39 legislative districts, rather than having 32 people from Albany, like you just mentioned. Maybe we just have one from Albany, like they're supposed to have, 4 or 5 from the legislators in Albany.
Mr. Joyce?
When you received that data, did it state how many people actually applied for these internships?
That I don't know, but my understanding is there weren't that many who were turned down.
I don't think we turned any
I don't know if
down.
we turned down, I think maybe there might have been one that didn't work out.
There were fewer this year than last year, correct? Yes. Weren't there over 100 last year?
But if we don't turn
How
any,
many, no, I thought there were fewer, there were more than 73 last year interns?
We had the same number of participants in the program this year as last year.
Same.
There was just a different allocation between those who are college age and those who are high school age, which just happened to be a little heavier on the college age.
They had 73 last year?
Yes.
Okay.
Do you know about any returns?
Yeah, we had probably a third
Third?
were
Okay, so
returned.
30%.
do we know if we turned anybody down? Were there more than 73 applications, or?
There may have been more than 73 applications. In some cases, folks, when we tried to place everybody with their top choices, other situations came up that had better offers, so they declined. If you didn't show up for your interview, we tried to reschedule. Nicole worked tirelessly to accommodate all those. We had tremendous help from Wanda as well, who did an enormous number of interviews to help us make it work. So there were very few people who, went through the entire process, but then were turned away.
Sam, do you think if a member wants to place an intern in a department, that they're pretty vocal about it, that they'll contact the chair's office or the majority and say, hey, we want to place this?
Yeah, I mean, that's another thing to just remember, that 73 people didn't work in the legislature, the 3-4 offices in this program. We have partners within the executive branch, and they have been, very interested in being supportive of our intern program in that regard. Most of the time, if folks have a candidate who is interested in the opportunity, obviously we're going to do everything we can to, find a placement for them in an area that is interesting to them.
Can anyone explain why there was such a discrepancy among districts? Because that's pretty pronounced, where 11 legislators had no interns.
Folks promote the program better than others, unfortunately.
All right, well,
Better at that.
I had 5, so I don't know any of the 5 that I had. I'm not personally acquainted with them. I did put it out on Facebook. I go to neighborhood association meetings and talk about it there. But beyond that, nobody asked me to put a person forward. Nobody asked me for a support. It just happened that 5 were chosen, that must have 5 who applied. But I also have a district that has a high degree of college-educated people. And so maybe that just sort of perpetuates, they did it when they were kids, so they want their kids to do it, the Albany High. There's a lot of, You know, I don't know if it's as needed in different areas more than others, I don't know.
Well, it may be, you know, that's just better recruitment efforts among members. I mean, I did put it out there, but I didn't get any applications, although I'm not sure if they may have applied and they didn't tell me. You know, that's one thing maybe we can work on. But I do think that a more equal distribution would probably be a better situation. Ralph?
Just to let everybody know from when this internship program kicked off, I kind of had a part of it. I worked in the chairman's office at that time, and I can say that when it was kicked off, the highest concentration of those were always in the city of Albany. I believe at the time, and it's going back about 6 years, individuals were paid $15 an hour for their jobs, and the majority, the large majority were from the city of Albany and from the lower wards in the city of Albany. So that was something that there's always been a disparity, because those are job skills and things that we were trying to do for those that were helping out their families at that time, that they were probably the only employee in their households. But it's always had a disparity from when it originated.
I'm just curious, because there may be things some members can learn from others in terms of recruitment, because I think in some cases maybe members are.
Maybe members should contact the high schools or in their district.
Transportation might be an issue too,
Yeah.
because, you know, I know my
Yeah,
daughter's
especially down where you are.
She's not gonna
Yeah.
I mean, that's,
But we've had something, so.
With all due respect, I'm not even talking about, everything you people just mentioned is not what I'm talking about. I'm talking about a simple thing where there's some, Mrs. McKnight's district, Joe Brown puts an application in from her district, and he's the only one from her district, he gets hired.
so what
He's
hap-
qualified, he meets all that, he gets hired.
So if we
I don't know that
mandate,
people are being turned down now.
Well, we don't know if they are or not, we have no knowledge of
Those are the ones
that.
I can
What's the-
certainly, we'll go even deeper into the data than what you got today. We'll give you an exact breakdown of how many people applied from which age category, how many were requested by departments because they've been involved in the prior year. We'll build out in what we shared today, and I'm happy to pass that out.
Good. Okay. But back to why, I'd like to know why, what would be the problem throughout the whole county of Albany? The districts we represent, at least one boy or girl could be hired from that district if they apply. What's the problem with that?
So can I just ask?
What if they don't apply though?
If they don't apply, that's up to them. If nobody applies, that's one thing. I'm talking about the
That's what's happening.
Well, yeah, but that's true, they don't apply. I'm saying if they apply. If they apply, every district should have representation of an employee from their district.
So if,
That's not wrong with that.
can I just ask a clarifying
Yeah,
question?
yeah.
If a person
Sure.
applies, but we try to interview everybody, we really bend over backwards, we're here well into the evening.
I realize how hard you guys all work.
That's not what I-
I
that's-
realize all that. I realize we got a staff that gets over $2 million to do this type of things. So,
My
don't-
question-
you know,
my question
how
to you
hard
is-
it is.
If,
Mr., go ahead.
that wasn't my intention.
Well, no, it wasn't my intention either, but I know you work hard. I said the program is very successful. It's been successful, not only this year, it's always been successful.
My clarifying question is, if a person applies but doesn't show up for the interview, what happens then?
I guess you don't want the job.
So you can't just say if a person applies and.
No, you could say to Mr. McKnight, Joe Brown didn't show up, you don't have a job.
That's what we're doing now.
I know what you're doing now, but it's by choice. I'm saying, make it the way it's supposed to be, mandated. You doing it, him doing it, or me doing it is by our choice. We can jockey the books and jockey this kid apply, that
But
person.
if there's not-
Has nothing to do with it.
But if
It
it's
should have a
not-
matter of right. Why would you want some in your district to have a job? It's cut and dry. Send it out unfavorable, do what you want. Let the full membership decide what they want. That's all I'm asking. I ain't asking to discuss nothing. To me, it's a no-brainer.
Is there a motion?
I just had a question.
Okay.
I don't think you heard what I was asking.
I don't know what you say.
Or if we hire 100% of everybody that applies, aren't we already doing this?
No, it could be 100% from one area. I'm talking, get one for every area. I ain't talking how many we wind up hiring. I want one from every area,
For
if they
clarity, I
apply.
think he's trying to say there's 39 legislators. Each one of the 39 legislators get one of those 73 spots.
Geez, that ain't too hard to figure, was it?
So everybody winds up having one that they can wind up going into the
He
district.
translated. He's from
Oh, he's from Cohoes, he can translate.
Okay.
Oh, okay. Oh,
So we all reach out to our communities, we get 73 applications, maybe 10 from mine, maybe 2 from
Then it's on
Lucy's.
the chair's office, but you
But-
have 39
Yeah.
legislators that, and some, because I know I don't live, and I'm going off of 6, 7 years ago, 8 years ago. I don't believe anybody from the hill towns
Right.
participated in the program. So you may have some areas. I don't believe that I had anybody that participated in the 17th legislative district this year, but I think somebody was last year. But if nobody winds up participating, then what he's trying to say is that everybody gets one. So it's kind of like,
If they don't want that, they
Why
can vote it down.
don't you do something like in the spirit of, some sort of, in the spirit of trying to give each legislator one, instead of a mandate?
Well, I'll tell you the bottom line, my feeling is,
What am I missing?
I don't want people have to go to these offices, and talk to these staff people, and put on beg jobs to get a job. If that exists, maybe it don't exist. But if one area's got 10 or 15 kids working from another area ain't got nothing, I think there's something wrong with that. So that's why it should be mandated, that every district has a right to have an employee from their district, rather than 15 from
But
Green
has-
Island, or
but-
10 from Colony, or
But going back
7 from over there.
But going back to my initial question, Gil, has there been a problem?
I don't know, maybe we should look into it. Must be a problem, we got
Well,
a
then let's
discrepancy
look
right
into
here.
it before we-
The chairman just mentioned discrepancy in the figure right there.
There's no question,
Mark, I
there's an improvement opportunity on equalizing.
There is a discrepancy right now, isn't there, Mr. Chairman? You said there was a discrepancy.
There's no doubt there's a discrepancy.
Oh, okay, so
But
maybe
it
I'm
may-
not
but
all
it's-
wrong
It
then.
may be because some members are better recruiters for applicants.
I'm not talking about that, I'm
That's a
just talking
question.
about everybody should have right to have a job.
Or it's a transportation issue too. I mean, bus line doesn't go to the
To
Hill.
the nursing home, or to the hill town.
And there's nothing wrong with them arguments, they're all legitimate arguments, as long as Jim Brown got the opportunity to give all the reasons.
Well, they're
why he
having
don't
the
want the job.
opportunity now.
Is there a motion on the floor?
I'll make a motion, if it's not on the floor already,
No,
to
the
accept this
motion-
policy.
Motion made by Ms. McKnight, is there a second?
Is that to send it out with a favorable? or-
Why not? Favorable.
Favorable, or we want to have no recommendation?
I don't care
We'll
what
see
you do, as long as you send it out, I don't care how you do it.
I think we don't need a recommendation. I think at the time of next summer, if we finished this year already, we could probably retweak some
Do
things.
you-
if we
But
like.
Lucy, do you want to do no recommendation?
No recommendations, just send it out.
Okay, there's a motion for no recommendation, that's seconded by
Big
Mr.
boys and girls,
Shea.
we could do
Yeah,
that.
let the membership decide.
Okay.
They're the ones that should decide.
The motion is to send it to the floor with no recommendation, okay? All those in favor, say aye. Raise your hands, please. Opposed? All right, so it's unanimously passed. Okay, thank you, Mr. Rizzo.
Thank you, Mr. Chairman, thank you,
Gil.
All right, you have, can we go right, skip it to 6, because Gil is also a sponsor on 6. It's requiring that budget details regarding certain
Get your
positions be
lights on.
posted to the county website.
Okay, this is another, what I consider a no-brainer. It's telling the public when they come to our, excuse me, what'd you say, Jim?
I said, which means we're gonna argue with you.
Oh, we can argue.
Go ahead.
It's a no-brainer. Why, what's the matter with you people? You gotta argue about it.
Go ahead.
Call in the police.
Lighten up, everybody.
He needs to interrupt.
Lighten up, don't get so serious. This is very simple. We have a public hearing, the public comes down after we send for them about an appointment the county executive is making, and the job pays, let's say, $100,000. I just want the public, when they come down here and sit there and to discuss this at the public hearing, they know the salary's $100,000. As of now, they don't know at the time there. I just want some form of hard copy, something add to the resolution that's presented at the public hearing. It gives the salary of the job that the county taxpayers are shelling out for this position. That might be a new creation or a repeat job.
But
Let the
But you
public
said
know
a
right
hard
there.
copy, you're saying the website here. What do you want?
I want any way you want to do it, as long as they know at the public hearing, there's a piece of paper saying this job pays $100,000.
No, I don't have a problem.
Well, good, let's pass it.
hold on a second, Mr. Ethier.
Yeah.
Typically, we don't go have a public hearing when somebody's appointed.
Yeah, I said
Use
when
your local law.
we do have a public hearing.
Oh, so this is only to appointments that
Only
involve
a public hearing when the public comes down, when the public leaves the comfort of their home, come down to one of our wonderful public hearings, I want them to know what that job is paying.
Would you consider a friendly amendment?
I'm not considering nothing other than
Come
I
on,
send it to the
listen to
membership.
me.
I listen to
you.
nothing.
Come on,
I don't have to listen to you.
come on.
I take
Well,
care of the
I'm not
public, I don't care
supporting
what you guys do.
I
Send
would
it to the
support a
membership.
range of salary, but I wouldn't support an actual
I
salary,
don't-
and I'd like to tell you
Well,
why.
first of all, it ain't our salaries, well, listen, the way we're all taxpayers.
Fine.
It's taxpayers' money. Why shouldn't they know what that job pays when they come to the public hearing?
Well,
Why not?
Wouldn't that be
What are we
announced?
hiding? Ain't our money?
I'm okay with announcing
Well, so am
that
I.
at the public
Good.
hearing.
Then let's pass it.
Because I'm not gonna see it on the website though.
I don't care to sit up. I'm told when they come down here to get out of their car, house, come down to their car, give up their hour and a half to get down and listen to us, talk about these resolutions, and nothing they're saying, oh, the county executive created this job? Oh, it's a great job, we need it, okay. Well, what's it costing, Mr. and Mrs. Taxpayer? Oh, there's no number there. Well, what's wrong with putting the number there? Oh, at that job, that's 50,000, 100,000. What's wrong with that?
Well, what I'd like to amend the resolution to say, when there is a public hearing for an appointed position, that we announce that at the public hearing. Does anybody-
I'll make that motion because there's no public hearings for hirings, but I'll make that
Well,
motion.
that's my question, but I'm not
I'll make the
aware of
motion,
it.
sure, let's add it.
Okay.
This all developed at the last meeting when the public were creating that economic job. They didn't want to put the price out there for the public to know what it was. That's what brought me to the conclusion to bring this out, that the public should know. At that committee, they just said they weren't going to do it. That's what this is all about.
All right, so
You're not talking about,
we have an amendment by Mr. Joyce that says when there is a public hearing regarding an appointment, that we state at the public hearing the salary. Is that accurate, Mr. Joyce?
Sure.
Okay, do I have a second?
So you no longer put it on the website, you just make the
Well,
event?
Well, we're going to have to vote on that subsequently.
this is never gonna happen.
I know I'm not on the committee, but, so, any resolution that we put up, whether it's public hearing, non-public hearing, local law, non-local law, it goes on the website, correct? So everything is posted on the website. So I think that what Mr. Ethier is trying to say, and maybe I don't know, we speak up in God's country, we have a certain language. I believe that what he's trying to say is that if there is a public hearing and that there is a notice for a public hearing, on that notice
So Troy, what are they trying?
for the public hearing, if there is an appointment, that the salary, the budget line, I would call it, the appropriated line in a budget would wind up being put on that public hearing notice, which is then in turn posted on the website. So it's not a separate website issue, but it's posting what the allocated or budgeted amount is for the salary. Whether or not that the executive winds up filling it at the top of the line, that is his sole discretion as the county executive, that he has that ultimate power and say-so. But it's anything that, for appointment where we have to advertise, I believe, I could be wrong and I could be
100% on
wrong.
target. 100% on target. It's hard to get across
Okay, well,
sometimes.
I believe there's an amendment that's been proposed by Mr. Joyce. Is there a second?
But he's got to accept the amendment too.
You
In a
like
sign of
it?
good faith, Lynn, I'll accept that.
Then say-
I'll second the
And
amendment.
second by Mr. O'Brien, all in favor?
Aye.
Opposed?
For sure.
Unanimous?
Next month.
He has it, he had
The
described.
amendment is, if there's a public hearing
It's just a public
involving
hearing,
an
and only a
appointment,
public hearing.
you have to list the
For a
salary,
position.
announce the salary at the public hearing, so people know how much they're proposing. And it passed unanimously.
That's fine. But
I think the taxpayers would be very happy with that decision you people made tonight.
So, too bad, it's not gonna be-
Now we have to vote on the
Take the
resolution
resolution now.
As amended.
as amended. Is there a motion?
I'll move that.
And I'll second that.
Second by Ms. Knight. All in favor?
Aye.
Aye.
Opposed? Unanimous. Thank you, Mr. Ethier.
Thank you, Mr. Chairman, and your committee.
Item 5 is requiring that the legislature attendance records be posted to the county website. Mr. Signorachi.
Yes, sir, thank you. And first I want to commend yourself and Mr. Kakis for all the work that you, Kakis, sorry. I have the problem, I'm Italian, I can't pronounce things.
Signorachi, gotcha.
Thank you.
You guys are doing a great job with Granicus and moving us forward with putting us into the 21st century. My idea of this resolution is that until that we have a time when everything is alive and we're on Granicus, that we wind up keeping track and posting. And I know it's, you can look in the minutes, you can look here, you can look there, but more or less just something that you show your attendance record. And the one thing that's not reflected in here, and I would ask the committee to make an amendment, or if it's possible to amend it on the floor, I'd rather do it all through the committee process, so it's not a whole bunch of things if I'm so fortunate to have this go out, is that we also include committee meetings, so that you have a situation where individuals that go to the meetings, if they go, they show, they don't show, it shows that their attendance. It's something that we are under the public spotlight. I believe it's good government and only showing that we actually care about our roles and all the duties that we have as we're elected. And I'm looking for a favorable recommendation, and I do want to include the committee meetings. I know it was one of the things that a couple of councils brought up. It does not include attendance for those that want to attend a meeting, that don't sit on the committee. It would only be for those that serve on this committee. So hypothetically, those 9 members that are here, Mr. Grimm, Mr. Ward, Mr. Touche, Mr. Joyce, Ms. McLean Lane, Ms. McKnight, Ms. Lakakis, Mr. O'Brien, and Mr. Stevens, they would wind up showing their attendance record prior to the 30 days that you'd have to wind up waiting to look at the minutes, that we could wind up posting something in that time frame, so that we have the record that winds up going up on YouTube from the camera behind us. This would wind up just showing the attendance on who shows, who doesn't show to all of the meetings. Once Granicus gets here, and I'm sure it's a wonderful program and I'm looking forward to it, then all bets are off. But I'm just trying to bridge the gap from today to the time Granicus gets here.
So what's the start date on?
As soon as this is passed, hopefully on September, what is it, the 11th, 12th?
Okay, going forward.
Going forward until Granicus gets here.
Okay.
Once Granicus gets here, then it's all...
Yeah.
Yeah, that's fine. I didn't know if it's going back 15 years or 20
No,
years.
it would be just going from the time that this is posted. Then, I mean, if Granicus can, from the presentation that I went to, you can upload data into it. So once Granicus gets here, they can upload all of that data, they can have fun. I'm just trying to do it from a starting point to Granicus, bridging the gap. Granicus gets here, and then all bets are off, and it's all fine and dandy. And again, I do appreciate all the time, effort, and energy you put in to bringing us that, to get us into the 21st century. So again, kudos, and hopefully I can have a favorable recommendation for...
One other question.
Yes, sir.
You've got committees, legislative meetings. What about task force?
There is a task force, and I don't want to get into semantics, but if a task force is passed by the legislator and it's an actual task force, then yes, then those would wind up having...
We won't get into semantics.
I don't, but I'm just saying, but however it is that there's a meeting, then I'm good with that. But we would have to amend it to include committees, because committees aren't on the current agenda, on the current resolution.
Is there a motion?
Still a quick question, though, still waiting for Joe to wrap up. And I think I was gonna ask the question earlier, but I think you answered it. You mentioned the committee meetings, and obviously the minutes being posted on the website includes the attendance. So you're saying because of you don't wanna wait for the posting of the minutes? Okay, got it. All right, no problem.
So it would wind up being,
Immediate.
So you can wind up going up and you can put another little link where there's agenda, backup, another little link for attendance, boom, 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 boom. Those that use the website, there's, different links, and you can upload, you put the 9 people on the committee, and you can wind up uploading everything. And some people that, when we don't have a quorum on certain committees because of individual schedules, that's just one of those things for individuals to wind up knowing. And again, it's only to bridge the gap, but in order to include the committee meetings, I don't believe that this version does that. So I would also like the committee to make an amendment that council make the necessary changes and amend this resolution with a friendly amendment to include the standing committees and members on those standing committees, not other legislators that are present. Like I was here for another committee. It doesn't count for me. I'm not on personnel. Even though I have legislation that's before you guys, it doesn't count my attendance as being here. It's only those that serve on the committee, that 9-person panel.
Let me just say, I think what we've been able to do with the Modernization Committee satisfies this intent. Because all the meetings that are going on between now and we put this online, they are all going to be available. So that record will be provided.
Absolutely, and
So
going
really
back
think
for the
this
last
is
2
really
years as well.
Unnecessary.
It's for the next 3 months to bridge the gap,
That-
and it's
all-
good
all that
government.
information will be placed
I
on
believe it's
Grant.
good government, and I think that if it's not passed, then you're saying that you don't believe in good government.
No, I
My
think,
opinion.
I think it's clear that the new system.
Very
will
good
be
point. That's a very
transparent.
good point.
Good government showing transparency.
Well, that's exactly what this system.
It does,
that
but
we
that's
created does.
4 or 5 months down the line. This bridges the gap for those 4 or 5 months. For our constituents that
What is
want to
the will
know
of the
whether or not
members?
that we're here.
What would the members like to do?
Well, I actually have a quick question.
Mr. Joyce.
Ralph, I like this, and it might even go on as a co-sponsor, but did we, is there any cost to, with IT, building this onto the website? Have we
I
talked?
would think that there would be minimal cost, if anything. Yeah, that's for an
Okay.
annual year.
An
So
update?
What would the fiscal
Okay.
impact statement be?
Be less than
Yeah, no
$5,000.
fiscal
So here's the thing, I can do a fiscal impact statement, and the next month I'll wind up saying I want it out and invoke the 60-day rule, or we can all wind up trying to work together and wind up putting this out with a favorable recommendation.
I'm okay with it.
Mr. Bergdorf.
I'm not a member of this committee,
Yes, sir.
but
And you have lovely shirts.
thank you. I think you're trying to swat a fly with a cannon. May I make a suggestion? We have official attendance records for all committee meetings, all legislative sessions, and from the date in which they changed the rule, even the public hearings. Why don't we create an Excel spreadsheet that says Paul Bergdorf has a line for meetings, all the meetings that I attended, committee meetings, Public Works, Law, Finance, all those that I attended.
Let's just do
Okay?
this.
It's one Excel spreadsheet. It's not rebuilding a website.
This is
It's,
rebuilding.
it's simple, it's easy.
However, you know what, that's fine too, I take that as, if
And
that's
it- and
the
it-
easiest way.
And if that solves a problem until Granicus happens, it would seem to me that would be a
Absolutely.
very easy thing to do.
Absolutely.
Let's, I vote to move this with the changes that.
Amended changes.
Amended changes.
Let's be clear about the amendment. Yeah, go ahead.
Restate it.
I just want to clarify for the members. From what I'm hearing, it sounds like what's proposed and without putting words in your mouth, the first resolve clause, we would put in language on the third line, after public forum, to the extent, we would put something to the extent of, or in committee meetings. Is that correct? It has to be in the resolve.
Special and permanent meetings or committee
Okay.
meetings, legislative committee meetings, however.
Standing committee.
Standing committee meetings. That's however, and I defer to you, and your words are a lot better than mine.
Standing and special?
Correct.
Ralph? Okay.
With the airport authority meetings or the youth detention center meetings, would they be
No,
in the
these are
categories
just,
of these?
these are just our standing meetings, our committees that we have within the legislative body.
Okay. They're appointed by the legislature.
So it's the standing committee and legislative meetings.
Correct.
Only.
That's the change, that's as amended. Whose amendment is that? Your-
Joe's.
It was mine if you
The
would be so
sponsors agreed
kind.
to amend as described. Can we have a vote on the amendment? Mr. O'Brien is the motion. Any second by Joyce. All in favor?
Aye.
Opposed? The amendment is passes unanimously. Now on the resolution as amended.
So we need a vote
We need a-
resolution as amended.
Resolution as amended. Mr. O'Brien is the motion. Mr. Joyce is second. All in favor?
Aye.
Opposed? Unanimous. Thank you.
Thank you.
And now, for the grand finale. Are we ready?
Okay.
Oh, yes.
I'd like to speak to this resolution.
Number
Number
seven?
Resolution.
No, you're the chair, can you speak to it?
I certainly can. Amending the rules and regulations for Albany County employees regarding longevity pay for elected officials. I thought really this was a joke when I first heard it, that there's such thing as longevity pay for elected officials. We know what longevity pay is.
Give me any, I don't know.
Yeah, by the way, just for the record, no county legislators get longevity pay, just so we're clear for the TV folks watching also. We know what longevity pay is for. It's something to be negotiated between the employees and
Yes.
management. It's part of the compensation package. There's a give and take, and longevity pay is part of that give and take. of course, it's a bigger step to go to elected officials where there is no such negotiation. I also feel when you give longevity pay for an elected official, you're really using taxpayer money as an incentive to keep them in office longer. That's what longevity pay is about, and which is actually contrary to term limits. It's the opposite, using taxpayer money as an incentive to keep someone in office. I don't think it's right, and that's why I proposed it. Any questions, comments?
Could you give an example of longevity pays that we are now paying?
Oh, sure, it's 5, 10, 15, 20 years, there's a schedule, depending how long you're here. It applies to all employees, but it also applies to elected
Electeds.
officials.
What electeds are getting it?
Well, certainly the ones that have been there the longest, Mike Connors and Michelle have been there the
The
longest. they get the
controller's
most.
office, okay.
But it's graduated, and it's the same, I believe, it's the same scale that every employee gets.
Yeah.
But of course, the employee is a negotiated arrangement between the union and the management.
Just to be clear, Mr.
Yeah.
Chairman, this
Yeah.
longevity pay is not just to, this applies across the board to all employees, with the exception of the legislature. It's not there's no distinction between union and non-union, all employees get this.
That's right, but it's, I mean, the non-unions follow, I'm sure that they follow what the unions negotiate. Okay. What's the feeling of the members?
I have a question to clarify this. It says, whereas many elected official positions throughout the country have term limits, further emphasizing the importance of performance, not length of service. That sentence doesn't make sense to me.
Hold on a second.
It's the fourth whereas.
Many elected official positions throughout the country have term limits, further emphasizing the importance of performance, not length of service for publicly elected officials. In other words, length of service, that's the basis for longevity pay, length of service. So this is opposed to making length of service as a
But
basis
you're
for
tying it
longevity
to
pay.
term limits, so, if you have term limits, that sentence just doesn't make sense to me. Maybe it's me.
Okay.
Well, because I think what you're saying, Rick, is that term limits really don't have anything to do with performance, they have to do with term. The time is up.
Elected term.
No matter whether you did your job well or badly, the time is up, so you can't run that. Whereas this is not what you're saying, and I think what you're saying is that you shouldn't get augmented pay just because you've been there for a while. That's your point.
Okay, well, I'll be glad to amend that, Rick. Instead of performance, the importance of
So what do the term limits
legislation.
emphasize?
Term limits is
The importance
legislation.
of?
Yeah.
What,
I'm glad to strike performance complete.
can,
Legislation, which of course we're trying to do.
Mark, if you've got a 25-year employee that's getting longevity pay, and you've got a 25-year county elected official getting longevity pay, why should he not receive it, or he or she not receive it?
Because when they move into elected status, it's a totally different ballgame.
I agree there.
Elected status is determined, your longevity is determined by the voters at the end of your term, which is something completely different than your typical employee who, in many cases, the point of longevity is to say we don't want to lose seasoned employees, so let's sweeten the pot a little bit, and it's a negotiating. We don't negotiate with elected officials regarding the pay. That's set by the legislature. Oh, by the way, another issue I have is you can look up what the salary is of a legislator from the budget line item. You can't do that with longevity pay because it's blocked in for each agency. It lists the amount of longevity pay. So you wouldn't know necessarily what the elected official is getting in longevity because the block line for longevity pay is for the whole agency. Yes?
Just a question, how long has this been in effect, this longevity, you know? Anybody here know?
Mr. Ether, this has been in place for decades.
Decades.
Now, for employees or for elected officials?
For all county employees.
Including elected officials. Full-time employees.
So that's been there all these years.
Yeah.
And I know you're opposed to, you want to change it.
Yes.
Has this become a big issue? You think the vast majority of county residents are well aware of this, and they want this?
Well, when they become aware of it, they don't like it, I can tell you that. I don't think the public likes the idea of bonus pay for elected officials. I can speak with reasonable certainty about it.
Well, they think that our elected officials in the higher echelon, our elected officials are running for that purpose, they would just vote them out. But these guys have been reelected several times with this thing out there. I don't think, that's only my opinion, I don't know if this
I
is a
don't think
big
people are
issue.
aware of it. I really don't. I think people would be
I
very
wasn't aware
surprised.
of it.
I wasn't aware of it. I thought it was a joke.
Well, now that you're aware of it,
Yeah,
you
now I
guys
want to
are.
change it, yeah.
Yeah, you want to change it, but now that you're aware of it, would you vote against one of these elected officials because of that thing being there?
That's a judgment you make on 100 different factors.
Well, what would your judgment be?
My judgment would be based on the 100 factors that I would.
Well, I have
consider
one
for any-
factor,
for any
I would
candidacy.
vote for him based
It's
on
not about,
if
it's
they can
not,
do the
it's
job,
not
I
about
wouldn't
the
care about
candidate.
longevity.
This is about the principle, should there be bonus pay for elected officials? It's not about an individual candidate, and our elected officials, by the way, shouldn't be taking this personally, because their current compensation will remain throughout the end of the term. This would be for the next term.
I just think, I don't think it's on the minds of the vast residents of Albany County. With the money we have in our budget and the money that's a lot of times wasted, I don't believe this is an issue in their minds. I could be wrong. I could be wrong. I could be wrong. If they don't want these people in there, vote them
If you're
out.
elected for a 4-year term or 2-year term for that salary, that's what it should be, not longevity. I
That's what
don't,
the expectation is.
what do the other counties do?
Well, there is a
We have
there's a
62
big article, that most places do not do it, okay? But, you know, that's why I think we shouldn't be doing it either. Orange.
There's also the question of the statutory requirements for publication of the salary associated with an elected official. So when you publish the notice for the elected office, you're supposed to publish the salary. The salary obviously is different depending on who may be the victor in that particular case, because if a newcomer comes in, wins the job, then it's one salary, but if somebody who's been in the job wins it, it's a different salary. So how do you meet the publication requirements for the salary when in fact it isn't just the salary, it's the salary
Same
plus?
election. Yeah, different salaries for the same election.
I mean, I can remember, I think two budgets ago, we voted on the salary of the elected officials, including,
15,000.
yeah, remember that? So, I mean, why are we giving them legitimacy?
I'd like to,
Mr. Touche.
another way of looking at this is that somebody that has 25 years' experience, I think that we pay for that experience more than we pay for somebody that comes in brand new with no experience. I think that 25 years of experience, or 5 or 10 or whatever it is worth something. I think that's worth something to the taxpayers of Albany County.
But that applies to employees. The question is whether elected officials who are both running for the same office, should they get the same pay? And that's not the case.
That's what I'm saying. Somebody that's been in that office for 25 years has a different skill set, and I think that it's reasonable to compensate somebody for 25 years of experience.
I see this applying to only one person in the county, is that correct?
No, it's all elected officials.
Four that have the 4 that are getting longevity pay? At what, 2,000 a year? For
It varies depending on
8,000
their service, yeah.
in a $600 million budget?
Well, it's a question whether it's the right thing to do now.
I understand, but it's, like Rick's point about the experience. So I don't know what you want to take a vote and.
Well, would the members be willing to send the floor with no recommendation?
Just to point out for the members, this was tabled in the law committee, so regardless of what happens here, it's been tabled in law.
Table
We can take that, I talked to law chairman today, we can take that up next month in law. Is there an appetite to send this to the full legislature with no recommendation? Is there a motion? There being no motion.
Can we table it in the committee and decide what
I move
Gloucester's
that
gonna
we,
do?
if you want to move it out, that we move it out with an unfavorable recommendation.
Okay. Moving out, unfavorable recommendation, the sponsor is Mr. Touche. Second?
Second.
By Joyce. All in favor of moving it with an unfavorable recommendation, say aye.
Aye.
Can you,
Yeah, raise your hand, please.
I'm favorable.
1, 2, 3, 4, 5, and opposed would be,
I did have a question, when would that go into effect?
at the end of the term.
In the next election cycle?
No, the end of the term, which is the end of the term. Okay, what's next?
Oh, finished?
That's it.
That's
That's
it.
it, okay, motion to adjourn.
Motion to adjourn.